Hi, welcome back to the Commonwealth Report. I'm Lieutenant Governor Tim Murray. My guest today is Christine Sullivan, the Executive Director of the Enterprise Center at Salem State College, though they want to be known as Salem State University, I think, at some point.
Yes, and they should, and they should, and they should.
A conversation for another day. We've been talking about how do we encourage small businesses to grow and expand. Clearly, one of the impediments, challenges facing small businesses today is the issue of health insurance and the cost of premiums that really have hit home and hit home hard. We've seen over the last decade, according to the Kaiser Family Foundation, that health insurance premiums have gone up 131%. That's a job killer. I'm talking to small businesses across the state that they're getting hit with 20 and 30% increases, in some cases even 40 and 50% increases. And just as an anecdote, personally, two of my brothers have a law practice in Worcester with another attorney and a paralegal, and they were in the process of hiring for a receptionist. They got their health insurance renewal notice, and their premium went up about $12,000, and are rethinking that. Now that story can be multiplied to hundreds, if not thousands of times right now across Massachusetts. What are you hearing in terms of small businesses? I mean, the governor and I have proposed implementing the emergency regulations that say to health insurance companies, you can't raise premiums in small businesses more than the medical rate of inflation, 3.2%. And if you want to raise it above that, you've got to come into the Commissioner of Insurance and justify those increases and explain why you need more than the rate of inflation. What are you hearing, and what advice do you give to businesses right now on the issue of health insurance?
Well, what we're hearing are the same things you're hearing, that businesses are getting premium increases like 23 to 46%, but not just this year, last year and the year before and the year before, and it's not sustainable. It's really killing them. We got an email from a woman who is owns a public relations firm that has been in business for 6 years, and she said, as a single woman, I'm responsible for getting my own health insurance. I just received notice in February that the monthly premium for Tufts Basic 20 plan I subscribe to is increasing 22%. That's insane. If I tried to raise my hourly rate for my clients by that amount, I wouldn't have any clients anymore. And that is kind of, to me, the core of this. She says, I want to hire people, but I can't do it. I feel, she says it's an unfortunate, vicious circle, because when the economy's been bad as it is, job growth is exactly what we need.
Well, I think in talking to small businesses, one of the things is they want a level of predictability and accountability to the process. And I think the idea that the governor and I have said and laid out is by limiting the premium increases to the medical rate of inflation on the health insurance companies. We're trying to get legislation passed on the medical providers, the hospitals, to say the same thing, that you can't raise your rates more than the medical rate of inflation. And put that in place for the next 2 years, and require the leaders, the CEOs of the health insurance companies and the leaders of the hospitals to get in the room and come up with a more predictable and sustainable process here, because we're going to all be out of business. Cities and towns, small businesses, large businesses, but particular small businesses where there's a lot less wiggle room. If double-digit premium increases, while salaries go up, and the CEOs.
I think you're right. In the long term, we all have to take a look, and someone has to deal with the cost containment issue. As the woman pointed out, if she tried to raise the rates on her clients the way they try to raise the rates on us, it's just not sustainable. And I think the idea of capping the rate increases immediately is really keeping everything from hemorrhaging, and I think that's really important.
Christine, thank you for joining us here on the Commonwealth Report. And to our viewers, as always, thank you for being with us. Christine, continue to grow and expand small business and jobs throughout the Commonwealth. Thank you for what you're doing for our viewers. As always, we welcome your comments on this show or ideas and suggestions for future shows. Please give us your feedback with the email address as on your screen, as well as contacting our Facebook page as well. So a lot of ways to get in touch with us. Give us your feedback, thoughts, and ideas. That'll wrap up this edition of the Commonwealth Report. Thank you.